Hello and welcome to PA114 Week 8. This week we are in chapter, 22, starting on page 403. This is a really exciting chapter. I really love analgesics, so I want to talk to you about that. But a couple housekeeping things before we get started. PA114, you do have a discussion question this week, which, let me look up what that is. I'm sorry, I forgot to do that before I started lecturing so that I could really make my lecture towards that because I like to get involved. So week 8, discuss the common side effects of narcotic drugs and give 2 examples of how those side effects can be used as therapeutic effects. So really interesting. Okay, so starting on page 403 with analgesic drugs. An analgesic is to provide relief from mild to moderate pain by inhibiting the release of prostaglandins from damaged tissues. They also talk about anti-inflammatories, which is to decrease inflammation, antipyretic, which reduces fever, and then anticoagulant, which is like an aspirin, prolongs the clotting time of blood. And so we'll go into that. Did you know? I love the history of these drugs. So if you can ever stop to read these did you knows, do that. It really gives you an interesting tip to then remember how to remember these medications. 1950, so many doctors relied on aspirin to treat so many conditions that the physician's phrase was take 2 aspirins and call me in the morning, because a part of the popular culture. This is something that you've probably heard before, but where did it come from? And so there it talks about that. Aspirin was first introduced in 1899, although for many years prior to that it was used for pain relief from its natural form, the willow bark. So aspirin actually comes from a natural source, willow bark. That is awesome. Drug aspirin is also known by its chemical name and abbreviation acetylsalicylic acid. Acetylsalicylic acid, if you can say that 2 times fast. And is also abbreviated as ASA. Salic, a Latin word that means willow. The drug category name salicylate was derived from acetylsalicylic acid, and the first drug in that category is aspirin. It goes into talking about the different names of aspirins. We have Bayer, and that's the brand name, and then there's so many different generic names, and then there are so many doses. So the low dose 81 milligram can be enteric-coated, and then you have the regular dose, and you can read all about that in your book. Moving on to, let me see, the non-salicylic analgesic drugs. So non-salicylic analgesic drugs include acetaminophen and other drugs that have different therapeutic effects from that of acetaminophen. So someone who is allergic to aspirin is allergic to salicylic drugs. So any ibuprofen, any Aleve, those are all under what is called an NSAID or salicylic medication. And acetaminophen or Tylenol is a non-salicylic analgesic drug and is not related to aspirin, so that if you're allergic to that, you can take this other non-analgesic but pain reliever to help with pain relief. So an analgesic is the where acetaminophen relieves pain is unclear. Again, antipyretic, which reduces fever, and acetaminophen does that, or Tylenol does that as well. It talks about how it's over the counter. Historical notes: within just a few days of each other in 1982, 7 people in the Chicago area died after having taken extra strength Tylenol capsules laced with cyanide. The first death was that of a 12-year-old girl who had taken the drug for cold symptoms. Several other deaths were in single family who shared the common contaminated bottle of Tylenol capsules. Each capsule contained 10,000 times the amount of cyanide needed to kill a person. Chicago police drove through the neighborhoods with loudspeakers and television network broadcasts warned consumers not to take Tylenol. The Tylenol drug companies Johnson & Johnson immediately removed 31 million bottles of Tylenol capsules from store shelves and offered to replace already purchased Tylenol capsules with Tylenol tablets. In response to this tragedy, the FDA set a deadline for all drug companies to convert to non-tamper-resistant packaging. The legacy of the Tylenol murders is still with us today in form of the tamper-resistant packaging. So do you want to know where tamper resistance came from? This is from the Tylenol murders. And someone had tampered with these medications. They were bought in the store, but someone had gotten into the box, had gotten into the medication themselves and laced them with cyanide. And so that is the reason now that we have the tamper in the pharmacy, over the counter in the pharmacy, that kind of stuff, so that you can always look for that. Really interesting stuff, I think. So moving on, okay, that, talking a little bit about that. Then we go into the non-steroidal anti-inflammatory drugs, which is like Celebrex. You see Vioxx, which was actually removed from the market, ibuprofen, and then narcotic medications like Dilaudid, Oxycontin. These are referenced as C2 medications. You can actually know they're C2 medications because on their label they have a C with two hash marks so that you know that they're a C2 medication. They are locked up in a safe. The pharmacist usually counts them. Sometimes if you are a trusted pharmacy tech, then he'll let you count them. I remember lecturing a little bit last week about if they are broken in any way, they cannot be dispensed, because actually the mechanism of action is if they're broken, they can be distributed differently, and so we know as a pain medication that we needs to be a homeostasis where it stays level, and we don't want, levels to go like this with pain. So, okay. All right, so I think you can read a little bit about that. I'm treating those. Goes into migraine headaches. That's a big one in the pharmacy that we hear a lot. People coming in with migraine headaches. So I hope that you have learned a lot from this lecture today, picked up a little piece here and there, and that you can use to answer some of your discussion question as well. Hope you have a great week and talk with you soon.